Professor Dror, you worked with ILO from 1982 to 2003, which is 21 years, after which you taught at the Erasmus University. How would you describe this change, being stationed at ILO headquarters as a senior diplomat and then teaching at Erasmus University? Would you say it was a huge change, or how would you describe it?
The universities are usually described as ivory towers. But in fairness, my experience is that probably ILO was much more of an ivory tower than the university. It was much more remote in many ways from the kind of reality, the kind of inquisition, the kind of challenge, the kind of inquiry that students force you to face. ILO required delivering services to many masters. The masters are countries, and within the countries it's usually ministers or high officials who are responsible for policies, and they need support in abiding by international standards which are set by the ILO and by others, and the doctrine of the ILO has to be upheld. So when you are part of a system as large as the ILO, you represent the doctrine. You don't represent your own opinions. And even if you have experience that suggests that this doctrine should be changed, it is not up to you to change it. It is up to the organization to adopt a different doctrine, which then is upheld by its senior and not so senior people. The university is a different game. It requires a great deal of intellectual freedom. It requires challenging questions and being constantly on the doubt, on the question. You know, when two academics meet and they agree on 95% of everything they know, the conversation will be about the remaining 5%. This is very different from the standard that you have in established bureaucracies, whether they're the international civil service or a national one. So the academia was in a way a very refreshing but quite challenging new route. The flip side of it is that the academia is very far removed from rural India or from rural Bangladesh. Most students have never left Europe. Most teachers didn't know what I'm talking about. Some were honest enough to tell me that they were so lucky to have done their entire professorial and research career in OECD countries.
Okay.
And why would I want to put up with all the difficulties, material, logistical, financial, climate risks, and people that low-income countries and rural places in low-income countries represented? I don't think I have a good answer for them. I cannot explain that to you or to them. Why would I go to villages when I really am not in any obligation to do so? And when I don't need to do it?
Right.
It's not for financial reasons that you go to villages. And it's not because I have been stationed there. I have chosen to be here and to face up to these challenges. So the university was a transition from a very safe and international, but very, very European environment to something that is very parochial, very local, but representing the biggest challenge that the world has today.
What interests me is that, you said the university was a new door, that it opened new doors for free thinking, or thinking more liberally, if I might say. What I would like to know is that what was your experience as at the university? Were there any students or were there any interactions which leave some impressions in your mind?
Well, you meet every year in every class some people who are extremely interesting, extremely daring in their thinking, and whom you would like to have as students for more advanced stages of their own career. students who write a thesis, students who go on to do the PhD, students who can teach me more than I knew before.
Mm-hmm.
So I could say that, yes, there are definitely a number of people. You wouldn't know them, so there is no point in mentioning names right now, but I have certainly great nostalgia to some of those encounters. Not everybody.
Mm-hmm.
And at the end of the day, universities are also transit places because students come, do their courses, and move on to the next. So you don't have a longer term work or intellectual experience with them unless they remain for a long time.
Mm.
But in MIA we do have that. We have a much longer opportunity to scope with people, to talk, to discuss, to analyze, and to do this intellectual quest.
Mm-hmm.
So MIA is a perfect location for a researcher who is interested in the topic, and I've never had such an effective and such a large and such a diverse, multi-skilled research group as I have in the MIA.
Okay. Professor Dror, your work and that of MIA, which you're so passionate about, is primarily focused on channelizing your efforts towards the cause of uptake of insurance among people from the informal sector in low-income countries.
Mm-hmm.
What approach or model do you follow, and to make it accessible to those who are at the base of the pyramid? And do you encounter hurdles in the process?
So you're asking about the model and the hurdles.
Yes.
Let's start with the model. We agree that many people in the informal sector are poor. Not everybody is poor, but even those that are not poor may be cash poor. They may have assets which are not easily convertible to cash. The habitual model has been to offer solutions which are cheap. But in insurance, as in many other things, if it is cheap, it probably also offers very little value, very little coverage. So that in itself creates the dilemma that we are giving low quality, low value at low price. This is the wrong model. Poor people do not want to have second-class quality or second-class quantity. They would rather have nothing than have that kind of a model. This is why we needed to redesign and not follow that route, but redesign a model in which people would be able to identify their own priorities. Since we're talking about rationing, rationing means some things will be more prioritized than others because we can't do everything. But if I were to tell you that I know better than you what is good for you, you might encounter that with a smile if you're kind, or with quite a lot of anger if you're less kind. Who am I to know better than you what your priorities are? This is what the development community has been doing for at least 50 years. We have all engineered and architected in Geneva and in Washington and in capital cities what we assume to be good and desirable for people. Our model is to ask them. Now, are they capable of answering these questions? Of course they are, because they are ultimately the only ones who suffer the consequences.
Yes.
And therefore they have to be in the middle of the action. If they're not in the middle, they're on the sideline, and you will be dealing with commodities, with supplies that nobody wants. In order to create the demand, those people who are expected to pay either in by consequences or with their own money need to be in the center. That's our model. You could say it's voluntary, it's contributory, and it's equitable. It also engages self-governance. Self-governance can be done in small groups. It cannot be done in very, very large groups. But we are still working at the level of small groups, and that's also my understanding of what micro is. And the reason why self-governance is so important is simply that when a group governs its own resources, its own decisions, its own options, it has more trust in the process. If somebody else takes all these decisions, they don't understand them and they don't necessarily trust them. And we've spoken how trust is important. So
Yes.
this is essential to the model. So contributory, voluntary, equitable, and self-governance. These are the features of the model. Now the constraints. The single biggest constraint has been to convince people at the top of the pyramid that an imposed, an imported solution cannot work at the base of the pyramid. Letting go of this control that has been part of development in all countries, or almost all countries, for very many years, for 2 generations, is difficult to change. It's still a great challenge, and it still creates all kinds of concern, sometimes fear, sometimes rejection, sometimes doubt, that one can actually engage with these people who are illiterate, innumerate, without experience with insurance, not very sophisticated, but that they have to be at the center.
Right.
That's the biggest challenge I've encountered throughout the last decade.
Okay.
Convincing the top of the pyramid that the base of the pyramid is actually not as stupid as it is. It may be resource poor, but not poor with other resources, notably devising solutions in spite of all the interventions, not because of them.
Professor Dror, let's talk about your India experience. In 2007, you began your journey with Micro Insurance Academy as the founding chairman and managing director. You could have worked in any part of the world.
What intrigued or motivated you to come and work here, and how would you describe your experience so far?
I came to India first in 1982. That's a very long time ago. I was very intrigued when I came back from that 6 weeks in India. It shattered my understanding of essentially how the world functions. I came from a setting where if you got good education and you could aspire for a good job, you would earn a decent living. By the age of 50, you would have accumulated enough to not worry about your retirement.
Sure.
And here I came to India, not ever having been to India
Before.
prior, and I saw a lot of people who were working very hard. Not all had education, but some did. And what I saw was that no way could they ever hope that by age 50 they would be with financial security. I also saw that the basic structure was that it wasn't about who I am, what I do, but it was who do I know, what's the part of my social network. So that's really a long-term background about India and the experience. I've been back to India in the 90s, in the early 20s, and I started working in 2005 on a research project
Okay.
where I brought students to India,
All right.
and we did work in 5 states, in fact even 6, in Maharashtra, in Karnataka, in Tamil Nadu, in Bihar, and in Rajasthan. And we did an early version, the first version of what we now call CHAT,
Okay.
choosing health plans altogether. So I had students who spent, in one case, 2 months in villages and did CHAT every morning and every evening. And a lot of
Students
people,
from Europe?
students from Europe,
Oh.
they had quite an experience with the food, with the weather, with living in the villages. But this aside, we collect a lot of data. We learned a lot of things, what works and what doesn't work in terms of engaging people in their choice. But then they said, now we've told you what we want. Now we've told you how much we're willing to pay. Come and do it.
Oh.
And I could not send them to anybody. There was nobody who was willing to come and do it.
Good.
And they said, well, if there is nobody who wants to do it, maybe you can train us and we will do it.
Oh.
And I couldn't send them to anybody because there was nobody who was willing to actually engage in that. This is why the Microinsurance Academy was created, to actually respond to that need, which is huge, which is urgent, which is interesting, which is complex, and which has not been taken care of until then. That's why the Microinsurance Academy came to be.
Okay.
And this is also what explains the motto of the Microinsurance Academy, as you can see, helping communities manage risks from the ground up. We're not talking about individuals, we're talking about communities. And we're not talking about top-down, we're talking from the ground up. Whatever does not work at village level with the community simply will not work in rural India.
Sure.
And rural India is just an image, because there are half of the world population is like rural India. So this is the silent majority that needs to be addressed.
When you came to India, you brought students, I'm assuming from Europe, who came to 6 different states, and they came across a huge cultural diaspora. What was their experience like, and what was your experience when you brought them here?
We had a few students who after a week had to be sent back because it was too much. But these were a small minority, and that's the risk you take when you take a big group of students. 10 from the Netherlands, 10 from Germany, and we also arranged 10 Indian students so that we would have a cross-cultural mix.
Sure.
The ones that were most reticent to go to the villages were the Indians.
My dear.
The others were very curious, not always very well equipped, and not always knowing exactly how to dress and how to address people, but they were very keen to go.
Oh.
They were all a bit adventurous, and that was great. The Indians had their own setting in this, and it was not easy to always get them to actually go to the villages, but they did at the end.
Okay.
So this was an interesting experience in itself, seeing that while we are in India, there is a lot of mileage that needs to be trodden with people from this country relating to other people in this country. This is very different from the gaps, the social gaps in Europe in general, in my country, and in very many other traditions and cultures. The other important message or learning or insight from this experience was that it's doable, that it's not hopeless. It's difficult, it requires a lot of tenacity, it requires a lot of conviction and a lot of perseverance, but it's doable. And here we are a few years after. There is still lots that needs to be done, and lots that will remain ahead of us. But the fact is, it has been until now doable under very, very difficult circumstances, because we are running a model which is not the mainstream model. So we can take a cue from Mahatma Gandhi, who was also trying many things that were not exactly the mainstream, at least at the early stage. And he told us, first they'll ignore you, then they'll ridicule you, then they'll fight you, but at the end you win. I don't know if we are beyond the ignore you phase already. I think we are. Yes, there is some element of having to explain and justify an argument about our model. There are some who view us as a threat to their financial interests, but not too many.
Okay.
And at the end, we will win.